Hello and welcome to another edition of Facebook Live with Advanced Pain Care. Today we have with us Dr. Jeffrey Higginbotham and Dr. Matthew Hellman. Both are double board certified in anesthesiology and pain management. Welcome, doctors. Thanks for coming today. If the audience wants to go ahead and start submitting their questions, we'll address those as we get a little bit closer to the end. Dr. Higginbotham, if you want to start us off and tell us a little bit about yourself.
Well, I've been in Austin now for about 12 years. Like I said, I'm board certified in anesthesia and pain management. Traveled around a lot and sort of stuck here in Austin. I joke, part of the reason I'm here in Austin is when I came down here and took this job, I was here for about a day, and my wife looked at me and she said, "You better like this job because I'm not leaving." So part of it was because we're active people, we like to run, and we were driving down the street and we saw 100 people out running. The year before that, I lived in Lubbock, Texas, and out in Lubbock, I think I would do 20-mile runs and never see another soul out running. So the vibrancy of the city, the activity, it suits us so well. So I practice primarily in central Austin near Seton Hospital, 38th and Lamar, as well as out here in Bastrop, where I'm standing right now. So we cover lots of area, and and Dr. Hellman is here as well. So.
Yep. Hi, my name is Dr. Matthew Hellman. I've been in Austin for about 5 years now. I've lived in 8 or 9 cities total, and this is by far my favorite. We love it here. Like you were saying, all the outdoor activity, exercise, recreational activities you can do here. I play in a couple of sand volleyball leagues, which is great. There's a huge community here for that. Because I really like to stay active. I'm able to take my dog on all the trails, especially even around the hike and bike trail downtown. And I practice mainly in the Kyle office and the Bastrop office as well.
So we've done quite a few of these Facebook Lives and kind of different topics and that sort of thing. And I'm lucky enough to be able to be here today to actually facilitate one of these. We're going to sort of step back with this Facebook Live, and instead of talking about nuances of the little things we do in pain management, we're going to stop and talk about the global things, like why we do what we do, what aspects of things are actually put together to like make a person as good as they can be. So a lot of it, some of it does with the little things I do, some of our injections, spinal cord stimulators, lots of these things, but those are only part of the story. The rest of the story is the function and what activities people can do, and that's a huge part of this. We can try to like do what we can to try to make stuff numb or to try to help with it, but really it's the idea is the next step is what are we going to do with that? And that's where we start moving forward to the functional aspects of things. So we actually found that in isolation, when we do any sort of treatment, unless we have the patient to buy in, to actually try to work on their end for their half, we just don't see as good of results as when we all work together to do that. So one of the ways is with the physical activity and, just healthy lifestyles. Not everyone, I treat patients from probably the age of 12 to 102. This is, I think, my oldest right now. So not everyone can do all the same things. And our anatomy changes, our bodies change over time. But it just, no matter how young or how old we are, we still can do something. So within that's what I try to work with patients and say, I joke all the time that with some of my patients that maybe their marathon running days are over because they know a lot of times I run marathons, but that doesn't mean that their life is over, their function is completely over. So we all dial that back and we can all do something with that. So, that's kind of why we're here. And I think, moving forward, I think we can really do a lot to try to help, coordinate things. Part of it as well, like Dr. Hellman as well, he's a super active person, and I think sometimes even being that role model to really try to push people forward to try to help, I think can be real good. So I'm sure you work through things as well to try to sort of guide the patients on, once we get it better, then we start working with little secondary things, little baby goals as we work forward.
Yeah, I absolutely agree. I have a lot of patients that come and see me, and we always talk about how they're sitting on the couch, they're not able to do a lot of activity because they're in a lot of pain. And I tell them, once we're able to fix your pain, don't go back and just sit on the couch. You were talking about going to walk outside, enjoying some trails with your dog, playing with your kids. That's the time when you want to get up and go out and start exercising and doing more and kind of strengthening all those back and neck muscles. just getting back into shape. Otherwise, you may just end up coming back in after a long period of time when that pain returns. And so my relationship with chronic pain begins when I was about 12 years old. I used to play hockey, and after being checked into the boards one time, I did suffer an L4, L5 herniated disc. And so I kind of understand the radicular pain that I had shooting down my legs that some patients share. I'm not saying all of it's the same, but everybody has fairly similar symptoms that can be related to a couple different things. And so I've been engaging in physical therapy myself probably my whole life since then to help out. And I have a couple patients, not a couple, many I should say, that have always asked me, once I get better, what can I do? I don't really have any training. I'm a little bit intimidated by going to the gym. I don't really know what to do. And the first thing I talk to them about is maybe some cardio exercise just to get you up and moving. I usually tell them to walk around their neighborhood in gradually larger and larger circles, maybe just a quarter mile the first day, maybe a half mile a couple days later, and always in a circle, because if you walk half a mile one direction, then all of a sudden you begin to feel your pain. It's going to be very tough to get that half mile to come back. And then they ask me about what to do to strengthen their back muscles and their neck muscles, because maybe they've been to physical therapy and it hasn't worked yet, or maybe they're a little bit intimidated of walking in there. And so what I usually tell all my patients is to avoid kind of the free weights and the larger weights that may have you moving in 3 dimensions, kind of push and pull or out and in and up and down, and just go use the machines. Maybe the ones that are, you change the weights with the pins, or the ones that are plate loaded. And so you're just moving in one dimension and you're just focusing on a specific muscle group. The ones that I usually recommend to them, first for the lower back, I don't know if any of you are familiar with it, but you could probably look it up. It's one that has a bar across the top that you can just grab and pull down. And if you just do that motion while you're watching us, you can feel it kind of open up those little joints in your back called the facet joints. It'll also work on the latissimus dorsi muscles as well. And so that'll help strengthen it and also strengthen those multifidus muscles around the vertebral bodies and around the spinous process, and then for the head and neck, people always ask about what they can do because they feel like they're slouched forward a little bit and their shoulders are leaning forward. And the machine I usually recommend is something that's a rowing type motion. If you just do it while you're sitting here, you can feel it strengthening your scapular muscles, your thoracic and cervical muscles, and it'll even strengthen the back of your shoulders and help pull your shoulders backwards so you're no longer kind of slouching forward a little bit with your head going down in that direction. I always say start with as little weight as you need and just do high reps and very slowly build up to it. And so most patients seem to do pretty well with that, and they have very significant prolonged relief. Once they come to us and get some relief from our procedures and conservative care, and then they're able to carry on themselves.
Yeah. And
I actually wanted to chime in real quick, guys. We had a question come in, and I feel like this is just the perfect place to put it. How do you guys feel that the body and the mind both play into pain? Because I can imagine that maybe somebody's made some gains, or maybe not made any at all, and then all of a sudden they feel defeated. How do you combat that with your patients when they're at the bedside?
Well, I think for me, it's all about habits, really, and trying to it's consistency. So nobody loses 100 pounds at once. Nobody gains anything at once. And the crazy thing is we actually don't see gains in real time. You have to do it over a long period of time, and then you actually look backwards and say, oh my goodness, I'm doing a whole lot better than I was before. So that's one of those things. It's all about understanding that within every given day, you just do your little small part. And if you're doing something, you're moving forward, you are making gains, even if you don't see it on that day. So one of the things I actually work with, and I've worked with this with many, many patients, is the fact that if you can just go all the time and just make it that way, the idea is to almost back it down where you actually have it where you almost, when you wake up the next day, you don't feel miserable. Mm-hmm. Does that make sense? So almost sometimes I'll back it down where they almost don't feel like they did a lot at all. They're almost like, well, I really didn't. I went to the gym, or I went.
Well, you never want it to be overly intimidating, right? That's like right. A process that they're not going to want to go back and have a little bit more of that exercise and that motion.
Exercise of any sort, whether it's running, weights or anything like that, it's hard. Anything that's not just laying around the couch is a positive thing. It's hard to do. So the goal is to try to make it as painless as you can and make it just super easy. You wake up the next day after a good workout, and everyone's super motivated day one, and they're absolutely miserable. They can't get out of bed, their back hurts, their arms hurt, and you know what? Now 5,000 excuses happen on why I don't want to go back and do that again. It just left a bad taste in your mouth. So what you can do, if you back that down to a point, and everyone's limiter is different, where you wake up the next day and you're like, that was okay. I actually feel okay, then all those excuses and all that secondary thing goes away, and you'll show up the next day. And you keep doing that, you'll do a whole lot more over time.
Yeah, I agree with you 100%. Nobody has linear progression or exponential progression, even if you're not in chronic pain.
Yeah.
Everybody will have a setback, or not necessarily a setback, but you won't be able to do what you did the day before, the week before, and that's okay, because like you were saying, just keep at it, push through it. You know, if it's something that's hurting, then I would stop doing it, but if it's just a little bit of soreness, it's okay to kind of continue and push through it a little bit. And then you'll see the difference, maybe not after a week or two, but if you keep at it, that's the biggest thing, the consistency, and just you'll see that you change your overall lifestyle, which I think is the most important thing in terms of managing chronic pain.
So what would you guys say, like how would a patient get started? So you're sitting at home, you're watching this, you're in pain. What's the first step? So call us, get a consultation, like take it from there.
Yeah, I think calling us and coming in and speaking with one of us or any of our other doctors, we're all very educated and well informed, and we have the same goals as you and each other. Come in and talk to us about what your biggest complaint is, as well as some of the smaller ones as well, and we can help formulate a plan involving conservative care, possible interventional treatments, maybe some medications, and just kind of get a global perspective, as we were alluding to beforehand, about how you can start to get better, which may be just through conservative care, or if you've already kind of failed that, there's something else we can do to help you, and then we can figure out a plan for afterwards to keep you doing well and keeping you as active for as long as possible.
Yeah, and everybody's limiters are different. You know, I for a long time did a weekly walking group before my kids got too old, and I was not able to find an exact day every week to do it. So, but within that, I had patients on walkers, and some people that have a little bit fitness, a little bit more, and we just tailored it. So not everyone could walk a mile. You know, so heck, you know, I've often joked with patients, they're like, can you go to the mailbox and back? And they're like, yeah. Okay, great, let's start there. And then maybe we'll try to go to the mailbox twice. You know, and we don't have to go out on a track, we don't have to go beyond it. You can start so little that, heck, you know, then once you get there, then you can always move forward on that aspect. So.
You're not pushing 5Ks on your patient is what you're trying to keep.
No,
okay, all right, that's fair.
Yeah, I mean, I try to be a role model. I mean, I'm active. I sort of, I try to embody that. But again, where they're at and where I'm at are two different places. And I will tell you, where I'm at right now is not where I've always been in my life. So, you know, I didn't come out of the womb ready to run marathons. That is blood, sweat, and tears. You know, and a lot of time and a lot of effort and a lot of success and a lot of failure that goes along with it. So,
Dr. Hellman, I have a question for you. You know, we talk a lot about spinal cord stimulators here at Advanced Pain Care, and today we're focusing a lot on the physical aspects and staying active. Are there any challenges once a patient has done the spinal cord stimulator trial and then maybe implant? Are there any barriers with physical activity for those folks?
It's funny you mentioned that, because I have one that I'm going to do an implant on soon who wants to return to playing pickleball, which I know has exploded in popularity in the Central Texas area.
It's big here, yeah.
Yeah, I just learned about it a couple months ago. And so what we usually say to patients is wait about 4 to 6 weeks afterwards, after the implant is done, kind of let everything heal into place. So it won't move, and of course, you know, it's very safely secured with some anchors that we put in there as well. But I don't really have any specific strong limitations for any of them afterwards. I always tell them, you know, when you start becoming active, go slower and see how it goes. Your body will tell you if something, you know, hurts a little bit too much, and then you can gradually work up to it. But I've had patients that I've done the implants in who have returned to playing golf. I told them I was able to take 30 yards or add 30 yards to their swing, but I couldn't guarantee if it would go left or right, which is exactly the end of having a bad hook. But now it's just going further into the woods. But it's still okay because we were able to add those 30 yards to his swing and to his length of the drive. But no real restrictions. You know, people have gone scuba diving afterwards when they couldn't before. And so really it'll set you up to enjoy life the way you could before you started having this chronic pain issue.
So you mentioned our golf players out there. I feel like this is a great time to mention that we have advanced orthopedics that we work with. So how do you guys handle that? You have maybe like an avid golfer or something or a sport that requires one of your joints, the big joints, right? How do you guys work with advanced orthopedic physicians here to make sure that patient is well taken care of?
Well, I think from my perspective, one of the beauties of having it sort of internalized where we can do is that all of our worlds collide really well. So we have continuity of care. We're able to, I can make phone calls, I can send them messages through our system. All the notes are there. I know when they get seen, everything goes, it's pretty seamless with the way it works. So that was one of the major changes when we started incorporating this. And historically, for the longest time, when we worked with other specialties, our worlds just didn't collide the way they should. You'd have a patient go to orthopedics, they would come back to me, and I was asking the patient, so what did they say? And that's not really the ideal setup for information flow. So this way, this works really well. We were able to do some of the conservative care ourselves. They also work secondarily, conservatively, and operatively if they need to really move forward. And I think a lot of these things, some of these things we can work with really easy, and some things require a lot more. But it'd be nice to be able to have, and this is where we work, is to have that ability to step up the ladder as the patient needs it. In the end, what's the idea is to get the pain under control, to get them moving forward. So however that needs to be.
So if it means you leaning on, another specialty within the practice, I think it's such a great setup we have here. I want to ask each of you, do you guys have just like a favorite thing that walks in? It's like, ooh, this is going to be fun to fix. Is there something that just really excites you? Dr. Hellman, you want to go first?
Fun to fix? Sure. I see a lot of patients that have chronic migraines. They've kind of been through all the usual medications or even Botox or some other interventions that just have not provided relief. And I have a couple neurologists that send me a lot of their patients, and there's something very simple we can do if it seems like it's not migraines and it's more related to the occipital nerve out of the back of the top of the neck. We can treat that. We can go as high as C2 or cervical 2 and 3, right where that occipital nerve comes out, and we can actually do some blocks for you there. And if you get some good relief and maybe decrease frequency and severity of these migraines or the headaches or the occipital neuralgia of what it actually is, then we can actually end up burning this occipital nerve. And this is not in the spine, it's off to the side. Everything we do is very safe, and this is even safer if you're concerned about that.
On my end, it's less about the actual condition than the patient. Mm-hmm. So what's really common in pain management is the person that shows up and sees me and says, I've seen this doctor, I've seen this doctor, I've seen this doctor, and nobody's listening to me. So that is, I think, my big role, is to sit down, to really get their story. Pain management, pain is everyone's got their story, and it's long sometimes. And you know what, to have that person to sit down and to try to see if we can figure out where they've been, what options may have been missed or not considered, less than missed, and then we can work on realistic expectations. And not everyone can reach different areas, but that's okay. Let's work together to see what we can do to try to make them as good as we can. And that's kind of where I see my role sort of sets up. We do lots of different things, and sometimes the person is only seeing a primary care doctor who just said, this is all the options are, and they have no idea all the different things we can do.
They'll just dismiss it so quickly.
And sometimes they're defeated because nobody told them the different things that we can do. So we kind of work through all of the aspects of things. So that's kind of where I settle on.
So we did just touch on the different specialties. We had a question come in. One of our viewers asked, can a patient come in and see multiple specialties at the same time, or is it like a handoff? Like what does that look like from y'all's perspective?
Yeah, they can make new patient visits on the same day. I've had plenty of patients that I've seen myself, and then they'll see orthopedics who's at the same clinic on the same day. And there's obviously something special about being able just to walk down the office and see your ortho doctor and just say, hey, what did you think? And we'll converse. It's almost like I'm back in my training program, and it's very easy to get in touch with somebody and they're not in other clinics, and we're waiting for notes like you were alluding to earlier. And so you absolutely can see multiple specialists on the same day. We even have rheumatologists and neurology and neurosurgery. There's just something fantastic about being able to see all of us, in a short period of time, if not the same day, and then we can literally just curbside each other, meaning we can just kind of walk by and talk about you in a couple minutes face to face.
So there's a rumor there's a couple new offices opening up. Are you guys going to be at either of those, and do you know which ones those are? I'm just going to give you a little quiz.
Waco? Not Waco, but Marble Falls.
Marble Falls, that's one of them. So we have.
They were getting a new office.
Yeah, so Marble Falls, and we also have Groesbeck and a Belton clinic. So that's even more for our patients to be able to utilize all of the specialties. So we're looking forward to that. Is there anything else you?
So we got a 0 on the quiz?
Yeah, that's right.
You both failed, but you both have great information otherwise.
Now we know.
But no, me personally, I think it's Central Austin and basketball.
I don't want to go to the questions either. Still in
I appreciate you guys hearing me. All right, another one from the live feed. For someone, so Dr. Higginbotham, you want to take this one. For someone that is an active marathoner that is trying to control discomfort and pain, should they visit you or set up a referral with the PCP? How does that look when you have one of your active patients coming in? What steps should they take?
Nowadays, they can just schedule with me directly. From there, then we kind of back up, and then I will coordinate care, whether it's with within myself / physical therapy. You know, I work with the chiropractic care as well for some deep tissue work, as well as secondarily things for, you know, some people end up having bad spinal problems, and at some point, you know, I can help with certain things. I can't fix all things, so we can work through it as it comes.
So we're actually going to be wrapping this up. We're going to just do a couple more questions. I wanted to ask just with that last question, any imaging you guys prefer a patient to come with?
Well, as of recently, we've started having the ability to do x-rays within the office, which has been huge. A lot of times sometimes the x-ray is all I need. And now, it used to be, historically, the paradigm was the patient came without imaging. I had to send them away for x-rays, then they had to come back and see me. Now, I'm doing it right here in the office, right when they get here. Sometimes that's enough. A patient actually I saw this morning, that was exactly what I needed. All I needed was the x-rays to do it. He had very classic pain. Sometimes it allows me to rule out some things, but I still need to get MRI, etc. But at least we're consolidating things into one visit instead of sending people back and forth and having to make all the phone calls and the patient waiting for days for reads and all that sort of thing from the radiologist. So,
are there any final thoughts that you want to share with our Facebook audience as we close this up today?
I guess we're looking forward to meeting all of you if we haven't already, helping you kind of regain what it was that you did before you started experiencing all of this chronic pain, getting you more active, getting you enjoying life. It's all about quality of life in the end, and our goal is always to return it to as high of quality as possible.
Dr. Hellman, anything you want to say? You guys want a bro hug? Bro job,
Yeah, there we go.
I'm not kissing on the cheek.
All right, doctors, that's all the time we have for today. I want to thank each of you for being good sports to Mike Hazing, and also thank you to the audience for the participation. We will be back next month for another Facebook Live, so stay tuned for that. And as always, at Advanced Pain Care, the pain stops here.